Hello, Assalamualaikum, and welcome back to Medix Mentor. This is me, Saber, and today we are going to start our mock test for the nurses who are preparing for the MOH exam for Saudi, Oman, Qatar, Kuwait, and DHA exam for the UAE. Congratulations, those students who passed the exam in this month. So I'm happy for you. Now let's move on the mock test. Question number one. A nurse is assessing the peripheral circulation of a patient's extremities. The chart indicates that the patient has edema in both lower extremities. Which of the following assessment techniques would the nurse most likely use to assess for this? A. Inspection and auscultation. B. Inspection and palpation. C. Palpation and percussion. D. Percussion. The correct answer is B. Inspection and palpation would be the most likely assessment techniques used to assess for edema in both lower extremities. Inspection involves visual examination of the extremities for the signs of swelling, redness, or discoloration. Palpation involves using the hands to gently press on the affected area to assess for the fluid accumulation and tenderness. Now come to the question number 2. Which of the following items is a barrier affecting proper implementation of the primary health care? Let's look on the options. A. Poor socioeconomic. B. Low level of fertility. C. Inadequate housing. D. Existing policies. The correct answer is D. Existing policies can be a significant barrier to implementation of the primary health care. Restrictive policies, inadequate funding, and bureaucratic red tape can hinder the access to healthcare services, especially for the vulnerable population. Question number 3. An immobilized 68-year-old patient is unable to straighten her arm due to the shortening of the muscles fibers. Which of the following define this defect or condition? A. Contractures. B. Venous stasis. C. Disuse atrophy. D. Disuse osteoporosis. The correct answer is A. Contractures are defined as the shortening of the muscle fibers due to the lack of use, which can lead to stiffness and limited range of motion. In this case of the immobilized patient, the inability of straighten the arms is likely due to the contractures that have developed as a result of prolonged immobility. Now come to the question number 4. The midwife performs an amniotomy on a woman admitted to the labor room unit. The cervix is 5 centimeters dilated, contractions moderate to strong, every 3 to 4 minutes, duration of 50 to 60 seconds, which should be her next action after assessing the amniotomy. A. Assess the fetal heart rate for at least 1 full minute. B. Assess the intensity and duration of contractions. C. Put woman on the left side and observe. D. Insert Foley catheter to ensure an empty bladder. The correct answer is A. Assess the fetal heart rate for at least 1 full minute. The artificial rupture of membranes can stimulate the uterine contractions and increase the risk of fetal distress. Monitoring the fetal heart rate is crucial to ensure that the fetus is tolerating the procedure well. Question number 5. A 21-year-old woman 6 weeks pregnant is diagnosed with hyperemesis gravidum. Which of the following conditions is expected as a complication? A. Miscarriage. B. Bowel perforation. C. Electrolyte imbalance. D. Pregnancy-induced hypertension. The correct answer is C. Electrolyte imbalance is a common complication of hyperemesis gravidum, which is a severe form of the morning sickness that can lead to the excessive vomiting and dehydration. Electrolyte imbalance can occur when the body loses too much fluids and minerals due to the vomiting, inadequate intake of fluids and food. Come to the question number 6. The registered nurse is supervising a graduate nurse providing post-operative teaching for a male client after an inguinal hernia repair. Which statement by the graduate nurse should cause the nurse to intervene? A. Apply an ice pack to reduce swelling. B. Practice cuffing to clear secretions and prevent pneumonia. C. Stand up to use the urethral if you have difficulty winding. D. Turn in bed and perform deep breathing every 2 hours. Correct answer is B. While coughing is generally beneficial to prevent pneumonia, it can also put stress on the incision and increase the risk of a recurrence after the inguinal hernia repair. The registered nurse should advise the patient to use the cuffing technique that minimizes the strain, such as cuffing with a pillow placed against the incision for the support. Come to the question number 7. If a person is habitually expressing anxiety through the physical symptoms, which defense mechanism the person is using? A. Isolation. B. Projection. C. Conversation. D. Regression. The correct answer is C. Conversation is the defense mechanism used by a person habitually expressing anxiety through the physical symptoms. Conversation involves converting the physiological distress into the physical symptoms such as pain, paralysis, or blindness. Now come to the question number 8. Which of the following site is the basilic vein? See the image. There are the 4 options. Choose the best one. The correct answer is D. The basilic vein is located on the middle or the pinky side of the upper arm, starting near the elbow and ascending towards the shoulder. You can often see it as a permanent blue vein, especially when the arm is flexed. Now come to the question number 9. While a patient was sitting in the recreational area, he saw 2 people speaking on TV. He called his nurse and whispered, "These people are chasing me. They want to kill me." Which of the following terms describe the patient's delusion? A. Grandeur. B. Jealousy. C. Nostalgic. D. Persecution. The correct answer is D. Persecution is the correct term to describe the patient's delusion. Persecution delusion involves the belief that one is being persecuted, harmed, or threatened by the others. In this case, the patient believes he is being chased and threatened, indicating a persecutory delusion. Question number 10. Nurse manager is open-minded, listens to the team, and understands others, and makes changes to improve unit operation and procedures. What type of the leadership style is this? A. Situational. B. Democratic. C. Compassionate. D. Transformational. The correct answer is D. Transformational is the leadership style that best describes the nurse manager's behavior. Professional leaders inspire and motivate their team members to achieve their full potential. They are open to new ideas, encourage innovation, and create a positive and supportive work environment. While the democratic leadership is also a valuable style, the nurse manager's behavior in this scenario aligns to more closely with the transformational leadership. Question number 11. A nurse observed that the physician is reviewing the patient's medical record. After the physician left the unit, the nurse takes the chart and discovers that the physician is not involved in the patient's care. As a professional, what action would the nurse take? A. Inform the supervisor on duty of the event. B. Report the physician to the medical director. C. Take no action since doctors can assess any patient's record. D. Confront the physician about reading the patient's medical record. The correct answer is A. Inform the supervisor on duty of the event is the most appropriate action for the nurse to take in this situation. By reporting the incident to the supervisor, the nurse is raising a concern about the physician's behavior and ensure that the steps are taken to address this issue. Now come to the question number 12. A nurse is in the labor room is caring for a woman in the active phase of labor. The nurse is assessing the fetal heart rate patterns and notes a late deceleration on the monitor strip. Which of the following is the most appropriate nursing action? A. Administer oxygen via face mask. B. Increase the rate of Pitocin IV infusion. C. Place the mother in the supine position. D. Document the findings and continue to monitor the fetal's pattern. The correct answer is A. Administer oxygen via face mask is the most appropriate nursing action in response to a late deceleration on the fetal heart rate monitor. Late deceleration are often indicative of the fetal hypoxia, and administering oxygen can help to improve oxygenation to the fetus. Question number 13. A full-term newborn admitted to the neonatal intensive care unit with the diagnosis of tracheoesophageal fistula. Which of the following nursing measures to prevent pulmonary complication and improve good prognosis of the newborn condition? A. Encourage exclusive breastfeeding. B. Insert nasogastric tube for the gastric decompression. C. Intermittent suctioning by double lumen catheter. D. Prepare for the insertion of the tracheostomy. The correct answer is C. Intermittent suctioning by the double lumen catheter is the most appropriate nursing measurement to prevent pulmonary complications and improve the prognosis of a newborn with tracheoesophageal fistula. Tracheoesophageal fistula is a congenital condition where the esophagus and trachea are not properly connected. This can lead to aspiration of saliva, gastric contents into the lungs, causing pneumonia and the other respiratory complications. Question number 14. Which outcome most significantly shows effective communication between healthcare providers? A. Decreased strength of hospital stay. B. Less obvious needs of clients meet accordingly. C. Proper educated clients. D. Reduce the number of medical errors. The correct answer is D. Reduce the number of medical errors is the most significant outcome that shows effective communication between the healthcare providers. When healthcare providers communicate effectively, they are more likely to avoid misunderstandings, ensure that all relevant information is shared, and prevent errors in the patient's care that can lead to improve the patient's outcome and reduce the healthcare cost. Come to the question number 15. A multifarious mother is attending at the outpatient clinic 2 weeks after her delivery for follow-up. While the nurse is assessing the mother, she could not palpate the fundus. Which of the following is the most appropriate nursing action? A. Document normal findings. B. Massage the fundus to be firm. C. Assess lochia amount and color. D. Admit mother to the hospital. The correct answer is A. Document finding is the most appropriate nursing action in this situation. If a multifarious mother is 2 weeks postpartum and nurse cannot palpate the fundus, it is likely that the uterus has already involate and descended below the pelvic brim. This is normal finding and does not require further action. Question number 16. A 7-year-old child is admitted to the emergency department with a head injury. The child is oriented to the place, person, and time, opens his eye spontaneously, obeys commands. The nurse is doing a pediatric glaucoma scale. Which of the following score the nurse should record? Option A 3, option B 8, option C 12, option D 15. The correct answer is D. The PGCS assesses three areas: eye opening, verbal response, and motor response. In this scenario, the child is oriented to place, person, and time, scoring 5 for verbal response, opens his eye spontaneously, scoring 4 for eye opening spontaneously, and obeys commands, scoring 6 for the motor response. Therefore, the total score is 15. Question number 17. A patient fails to progress during the active phase of the first stage of labor. Which of the following is the best nursing action? A. Perform vaginal examination to determine the cervical dilation. B. Ensure that she has adequate analgesia. C. Ask the family to give support. D. Perform an amniotomy. The correct answer is B. Ensure that she has adequate analgesia is the most appropriate nursing action when a patient fails to progress during the active phase of the first stage of labor. Pain can interfere with the labor progress by causing muscle tension and anxiety. Ensuring that the patient has adequate pain relief can help to relax her and promote effective contractions. Question number 18. Which of the following options decrease the natural immunity of the reproductive system during the menopause? A. Thinning of the vaginal epithelium. B. Dilatation of the cervix. C. Genital laceration. D. Cervical mucus. The correct answer is A. During menopause, the level of estrogen can help maintain the health and integrity of the vaginal epithelium. This thinning wall of the vaginal epithelium can lead to the dryness, irritation, and a decreased ability to resist infection of the reproductive system. Question number 19. A cardiac monitor for a patient in a coronary care unit shows the abnormal echo rhythm with heart rate of 159 beats per minute, wide QRS complex 0.18 seconds, and absence P wave. What would be the type of possible dysrhythmia? A. Sinus tachycardia. B. Ventricular tachycardia. C. Ventricular fibrillation. D. Supraventricular tachycardia. The correct answer is B. Ventricular tachycardia is the most likely dysrhythmia based on the given scenario. Heart rate of 159 beats per minute. This indicates a rapid heart rate. Wide QRS complex. This suggests that the electrical impulse is originating from the ventricles instead of the atria. Absence P wave. This confirms that the electrical impulse is not originating from the atria. These findings are consistent with the ventricular tachycardia, a serious heart rhythm disorder characterized by rapid irregular heartbeats originating in the ventricles. Come to the question number 20. A 28-year-old pregnant woman at 9 weeks presents to the outpatient clinic with the vaginal bleeding. During assessment, the nurse found that the fundal height is 12 centimeters. Which of the following is the most likely diagnosis? A. Placenta previa. B. Abruptoplacenta. C. Ectopic pregnancy. D. Hydatiform mole. The correct answer is D. Hydatiform mole is the most likely diagnosis based on the information provided. Vaginal bleeding. This is the common symptom of hydatiform mole, a begin condition where the abnormal tissue grows in the uterus instead of a fetus. Fundal height is 12 centimeters at 9 weeks. This indicates a larger than the expected uterus, which is often seen in hydatiform mole. This is the end of this test. If you have questions, you can ask me into the comment section, and also you can share your score with us into the comment section. See you soon and to the next video. Thanks for watching Medix Mentor.